So melanoma is a form of skin cancer, and it arises from the pigment in the skin, and the pigment is derived from cells called melanocytes, and they start to multiply, but they can multiply in different ways. When you're getting a tan, they can multiply, and that's what gives you a tan. But if they start to misbehave, they start to multiply abnormally.
Yeah.
That's what a melanoma can stem from. So that's the basis. There's different forms of skin cancer, but melanoma is one that has the potential for spread. It tends to spread either locally or through the lymphatic or circulatory system. But the key message is catching these things early.
Yeah.
It's not about how many, it's not about having a melanoma, it's about catching it early. And that's a very good question, because there's a lot of research in melanoma and there's different types of melanoma. But what we do know is that one of the risk factors is in relation to the radiation from the sun. So it doesn't have to be the heat of the sun, it can be cloudy days, breezy days, rainy days, and it's the radiation that's coming through the clouds. So we're keen to encourage people to get out in the sun, especially if it's a nice sunny day.
Yeah.
But the take-home message is to avoid burning, because we know that has implications on potential for things like melanoma. Not all melanomas, but some. What I would tend to say that there is what we call the ABCD rule, but the key things about change, the most consistent things about change, so whether it's in size, shape or colour, those are the three main factors when you're looking for melanoma. You can look for other skin cancers as well using the same criteria, but that's the thing, get to know your skin, and then keep an eye on it on a monthly basis, along with all the other checks, like your well-known checks, breast, testicular, but also keep an eye. So if you know your skin, you'll be able to identify anything that changes. And then keep an eye on it for a few weeks, because things do come and go in the skin. If you're not sure, then seek advice. Always seek advice. If a clinician or an expert says that looks okay to me, carry on keeping an eye on it. Take a photograph of it, take a measurement with the photograph, and then keep an eye on it. And if you're not happy or you're not sure, don't be put off going back again. So that's the key message I would say to anybody. And I say it doesn't matter what age you are. I always say, even if I look at something and say that's okay, I always say keep an eye on it, because if it does change, we want to know about it, or somebody needs to know about it. That's another valid point, because if you burn today, you'll probably peel in the next few days rather than tan. I know some people, we have different skin types. Some people get red before they tan. Pink, if it's pink and it's vascular related, fair enough, but we do tend to say safe tanning. It's all about getting a tan without a burn. So there's a lot of products out in the market now, sunscreens with an SPF or sun protection factor of 30 and above, and they're not sunblocks, so you will get a tan and you will get your vitamin D, because that's another thing, because people often will say, oh, if I don't go out in the sun, I won't get my vitamin D. But we're encouraging people to get out in the sun, enjoy it. It makes us feel good, makes us feel better, especially if you're active out in the sun. It's very good for a lot of health issues. So we're not saying don't go out, we just say stay sun safe, avoid burning, and enjoy it.